Good people, today is a good day. This one took a while coming together. However, I'm excited that we're now here. Joining me today is Dr. Leena Shahla. Dr. Shahla is an endocrinologist who is an expert in pituitary disorders and serves as the medical director at the Duke Pituitary Center at Duke University. Her clinical and academic work focus on the diagnosis and management of complex pituitary diseases, with a particular expertise on Cushing syndrome and acromegaly. She is also deeply passionate about improving awareness and promoting earlier diagnosis across both conditions. Now listen closely. Prior to Duke, she established a dedicated pituitary program at the University of Arizona. While at Duke, however, she has led the rapid development of the Duke Pituitary Center, securing official recognition as both a Pituitary Center and a Pituitary Center of Excellence. She's also developed a comprehensive perioperative protocol designed to streamline pre- and post-surgical care and improve safety outcomes for patients undergoing pituitary surgery. Now that's what I like to hear. But wait, there's more. She also leads the Duke Pituitary Tumor Board, fostering a multidisciplinary collaboration in the management of complex cases. Dr. Shahla, thank you for joining me today. Welcome to Talking on Acromegaly with Tony.
Thank you for what you're doing and for raising awareness about acromegaly. It's something we all need and mainly patients need.
Thank you for those kind words, Dr. Shahla. Let's dive right in. So, you began your medical journey in Syria and now lead a major pituitary center in the U.S. Were there moments in the journey where the path felt uncertain, and what kept you pushing forward?
Yes, there were definitely a few moments. First, when I initially uh, came to the United States, I faced a huge challenge that was only within a couple of months. Even my family asked me to return home, but I had a goal and I wasn't willing to walk away from it, which kept me moving forward. And the second came later on as I was trying to build and grow a pituitary program. I had a vision, but I didn't always have the level of support and resources I needed. And as an international medical graduate, not everyone will believe in you. So there was always this additional layer of having to prove myself, even though I worked just as hard or even harder. Anyway, I stayed focused, resilient, and continued to push forward. And with time, that led to growth and trust. And I am both proud and grateful for being here at Duke, working with a great team.
You sound like an acromegaly patient. You had to push forward and keep working hard. Believe me, I can totally relate to that. You've helped build pituitary programs in Florida, Arizona, and now Duke. What's the first thing you look at when building a program from the ground up?
You look at three elements. One, patient volume and referral pattern. You need a sustainable pipeline to be able to build a meaningful program. Two, alignment between neurosurgery and endocrinology. It's very important to have partnership between these two teams. And three, you need institutional support and resources. With having these three elements, you can build a successful program.
Let's switch gears a little bit. People with acromegaly, Cushing's, and other pituitary disorders want to know that the doctor that handling their care has experience and a strong knowledge with their particular condition. What are the biggest gaps you typically see when you walk into a system that doesn't yet have a strong pituitary program?
There might be a limitation in the resources, such as advanced imaging, specialized labs, or coordinated workflow. There also could be a lack in true multi-D collaboration, especially between neurosurgery and endocrinology. So it's not just about adding resources, it's about having a system that functions as one unit.
You've been able to do that in a few different places, and hopefully that has put a lot of people with acromegaly and other pituitary disorders at a level of ease, so to speak. Let me
I
ask you
hope so.
this. I hope so as well. I hope so as well. How do you align different specialties, the neurosurgery, endocrinology, radiation oncology, so that they function as one cohesive unit that's effective for patients?
It's important to have collaboration between neurosurgery, endocrinology, radiation oncology, and neuroophthalmology, where they function as one team. And with regular multidisciplinary conferences, case discussion, open communication, there should be also a mutual respect and trust across these specialties. So it's a combination of structure and culture is what drives a successful program.
When a center earns the designation of a Pituitary Center of Excellence, what had to happen behind the scenes to make that happen? And how is that better for patients?
Earning that designation is much more than meeting a checklist. It reflects a system that has been built over time and ability to deliver high quality care. Um, it requires consistent patient volume and will define true multi-D collaboration. That means neurosurgery, endocrinology, neuroophthalmology, and radiation oncology are working as one team with shared protocols, case discussion, open communication. Also, well-experienced surgical team is crucial. It also requires the right resources, such as staffing, advanced imaging, and specialized labs.
Right neurosurgeon is critical for people with pituitary disorders. I was lucky. I had a very experienced surgeon. I only had one surgery, and I'm so thankful for that, Dr. Shahla.
That's
From your
amazing.
perspective, how important is volume and experience when it comes to treating pituitary tumors?
Volume is important because it shapes experience, and experience enhances the outcome. Especially with pituitary surgeries, repeat and multiple surgeries will enhance experience, ultimately leading to better outcome and less complications. And it's not just about the surgeon, but the entire team being highly experienced and able to manage these cases correctly before, during, and after surgery.
Let me ask you this. Do you believe patients should actively seek out centers of excellence? And if so, why?
I do, especially in complex cases and when surgery is required. Um, Patients will benefit from a team that is used to working together, has the experience, and has seen high volume of patients and able to deliver comprehensive, high quality care throughout the journey. Center of Excellence offers both the experience and resources that patient need for better outcome. And now, when it comes to straightforward cases, care can be delivered locally. They don't need to seek a center of excellence.
Let me ask you this. What is considered a straightforward case?
Let's say simple prolactinoma. Prolactinoma is very common pituitary adenoma, especially if it's small. This can be managed locally.
Okay, I get that. Let's switch gears a little bit. You've presented nationally on the complexities of acromegaly. What makes managing acromegaly more nuanced than people realize?
Acromegaly is more nuanced than people realize. No two patients present the same way. It is a rare disease, and unfortunately, patients go for years undiagnosed, and that will increase the risk of comorbidities and lower their quality of life. So I do believe that care should be delivered in a long-term personalized approach, including surgery and ongoing management for persistent, if any, and recurrent disease, as well as managing their comorbidities. I do also believe that having a strong patient physician relationship is very important throughout the entire journey.
That is critical. And part of the reason that I started this platform is to introduce and bridge medical professionals like yourself with people living with pituitary disorders, because this gives us an opportunity to see you all outside of the office. Oftentimes, we don't get the opportunity to get to know anything about our doctors. And it puts some people in a position to whereas they don't know their doctor real well, they're nervous to ask questions, they're uncomfortable asking questions with someone that they don't align with. Let me say this, you are someone who likes puzzles.
I like complicated puzzles.
You like complicated puzzles. So a patient could align with you on puzzles, and they could probably have a better relationship with their endocrinologist, being Dr. Shahla, if they talked about puzzles. Does that make sense?
Absolutely. And um, it's not just that. I do feel that complex cases are similar to complex puzzles, and I like to dig deep and figure out the cause and what's causing the symptoms and how I can help that patient the best I can.
And your love for puzzles, in fact, led you endo- into endocrinology. Is that correct?
Yes, they're connected.
They're connected. Let's get back to presentations. You recently presented at the American Association of Clinical Endocrinologists, or ACE, at the conference in Las Vegas. Where do you see the biggest breakthrough coming from in medical therapy? I asked that question because I'm aware that you presented about one of the new medications, Palsonify.
I think what's promising is that we're moving beyond just biochemical control. Newer medications are just as effective, but also convenient and easier for patients. Palsonify, from my own experience, has been great. It's very effective. It's very convenient for patients. It's just a pill they take once a day. And it has additional effect, significant effect actually, on symptom control beyond just biochemical control. So I am very pleased with my experience with Palsonify. There's also now CAM 2029 under FDA review, and we have some new medications in trial. So I am optimistic that we will continue to see significant progress.
I can say that I'm also satisfied with Palsonify. I've been on Palsonify for a few months now, and I feel great. With that
I'm
said,
so glad.
thank you. What are some of the most challenging cases you've encountered, and what did they teach you?
I have a patient with acromegaly who was diagnosed more than a decade ago. Uh, Underwent multiple surgeries and radiation. His pathology showed aggressive features over time, and that's why his disease recurred. And unfortunately, recently we found out that he has metastatic disease, so now it's considered pituitary carcinoma, which is very, very rare. His care has required close collaboration between me, endocrinology, neurosurgery, and oncology. And despite multiple lines of therapy, his disease continued to progress, unfortunately. What that taught me on personal level, what stands out the most is the patient himself. Despite everything he's gone through, he has such a great, amazing, positive attitude. His resilience is so powerful and so inspiring. On the second hand, I do believe multi-D collaboration and care is very important and crucial, especially in rare and complex cases. I also can tell you that our current therapies are not enough. Um, we need to push the field forward. Unfortunately, pituitary disease is underfunded by the NIH. Um, we do need new treatments for certain conditions. For example, cabergoline is a medication that we use for prolactinoma, was approved in mid-90s, and we have not seen any advances since. Um, some patients cannot tolerate cabergoline and cannot have surgery, so they are stuck. We definitely need something better.
You've been invited to help lead educational initiatives through the Endocrine Society. What do you think clinicians still need to learn when it comes to pituitary disorders?
Pituitary disorders are rare and easy to overlook in everyday practice. One of the biggest gap I've seen is recognition and experience. Community providers do not encounter cases like acromegaly and Cushing's frequently, so diagnosis is often delayed. Um, on the other hand, management feels less familiar compared to diabetes or osteoporosis, much more common cases. So, the goal of educational programs is to spread awareness, to help with early recognition, ultimately, earlier diagnosis, referral, treatment, and better outcome for patients. And also, one of the reasons that these diagnoses get delayed um, is that they often get swept under the rug by more common conditions such as diabetes or obesity, which get more attention in everyday practice anyway. So I do believe that medical journals need to shine more light on rare disease rather than just focusing on hot topics in common areas.
That sounds amazing. I've got a follow up question to that. How important is it to educate not just specialists, but primary care providers who are often the first point of contact for patients?
It is definitely important because the primary care physician are the first point of contact. And like Cushing and acromegaly, they're rare. So with that, you have out of sight, out of mind effect. Education at this level is really about pattern recognition. When to suspect acromegaly or Cushing, how to screen, when to screen, and when to refer. So even small increase in awareness can make a huge difference by leading to earlier recognition, ultimately earlier diagnosis, treatment, and better outcome for the patient.
Dr. Shahla, how can we close the gap so patients don't have to travel long distances to get the right diagnosis?
First, by spreading awareness among primary care physicians and community providers and endocrinologists to help with earlier recognition and referral. To creating a regional network and partnership between specialized centers and community providers so they can extend the expertise without requiring every patient to travel. And three, telemedicine has been very helpful so we can deliver care to patients' home.
I've got a question for you that many patients have asked me recently to ask, and you are the first doctor that I'm going to ask this question to. Are you ready?
Yes.
Are you accepting new patients?
Oh, yeah, definitely. Absolutely.
With that said, you treat patients from multiple states. What does that say about access to specialized pituitary care in the entire country?
There's definitely a gap. One, because these conditions are rare, and two, because well-defined true multi-D clinics are not widely available. So patients unfortunately need to travel sometimes long distances to reach a specialized center to get the experience and resources they need.
Now, you answered the magic question that you are accepting new patients. You also answered the question that you see patients from multiple states. How does that work as far as with you seeing a new patient from out of state? What's the process and how does it work?
Um, it goes through referral system, but first visit definitely has to be in person because you still need to do that physical exam um, in person. And I think it's also important to build a rapport between the physician and patient. Subsequent visits, however, can be done via televisits.
I know it could be difficult building relationships with a new patient and a new doctor, but they certainly need to make sure on that first visit with you, bring a puzzle and everything should work out well.
That's true.
I think I have one final question for you, and I wrote this one down because I wanted to make sure that I got it out exactly the way that I written it. You help shape the future of pituitary care on a global level. But when you bring it all the way back down to the individual patient sitting in front of you, what matters most right at that moment?
At the end of the day, it all comes down to the patient in front of me. Patients deserve to feel heard, understood, and confident in their care, especially they go years without a clear diagnosis. So my focus is not only on delivering the right therapy, but also having a relationship that's built on trust, respect, and making sure I involve my patients in the medical decision making. Because while we build a program at a scale, care is always delivered one patient at a time.
I want to thank you for your time. I want to thank you for joining me today. Most importantly, Dr. Shahla, I want to thank you for talking acromegaly with Tony. It's been a pleasure to have you today.
The pleasure is mine. Thank you, Tony, for having me, and thank you again for what you're doing, and best of luck.
In closing, Dr. Shahla, additional thanks, not just for this conversation, but for the intentional way you're shaping the future of pituitary care. What stands out most to me is that you're not only treating patients, you're building systems that will outlast any single case, any single moment, and impact people you may never ever meet. For a community like mine, where delays in diagnosis are real, access isn't always easy, and where people are searching for answers, what you're doing is truly special. You're helping create a world where patients are seen sooner, treated smarter, and supported more completely. And on behalf of everyone listening, especially those navigating acromegaly and other pituitary conditions, thank you for your work, your leadership, and the vision that you bring into this space. We appreciate you very much. If you found interest in this episode, drop a comment, share it, like it, hit that subscribe button, follow me on all my social media platforms. And if you're interested in hearing from a poet, a playwright, and a best-selling author who shares her journey of empathy while living with acromegaly while diagnosing her 20s, click here and watch my conversation with Avery Toombs. Be strong, be encouraged, and thanks for watching.